Hi, welcome to our latest edition of Inside CRCAIH. I'm your host, Melissa Buffalo, and today we are in Rapid City, South Dakota. We just finished up a pilot grant seminar series, and we are with our guest speaker, Dr. Daniel Petereit, whose pilot was titled Walking Forward. So I'd like to introduce you. And if you could tell us a little bit about yourself.
Sure.
And then I have about 2-3 questions I was going to ask you.
Sounds great. Well, I appreciate the opportunity from CRCAIH to present. And so I'm originally from South Dakota. I grew up in Sioux Falls and spent time in the Black Hills. Used to work out here a little bit. And so when I relocated here actually 17 years ago after being in Wisconsin for 10 years, a lot of reasons for coming here. One is I love the area, but two, I was hoping there might be an opportunity to work with the American Indian population. So in 2002, when we received our initial grant funding, opened up that possibility, and so we're going on year 14, and we've been working on this curriculum project for the last 2 years, so it's really fit in nicely with what we've been trying to accomplish.
Okay, great. Well, we're very fortunate to have you in South Dakota. So just again, like I said, a couple questions. I wanted to ask you a little bit about your the projects you're working on. So why did you choose this topic for your pilot grant research?
So as a treating oncologist, one of the issues we see after patients complete their treatment is the whole topic of survivorship. And a lot of the ideas, or I would say most of the really good ideas, come from our own staff, and so they were really interested in doing some type of survivorship project. And so this particular project was looking at increasing physical activity for American Indian cancer survivors, and it was done through a cell phone app. So that was kind of the premise of those patients who are cancer survivors of at least 1 year and who were, felt like they wanted to do some level of exercise. This might be able to help them improve their quality of life.
Okay, great. Any challenges yet you encountered, and anything you want to address or discuss?
Well, I think it's always a challenge trying to do research projects outside of areas where there's a big university, and so probably one of the biggest challenges was recruiting participants. And one of our audience members correctly pointed out that we should have worked with one of the survivorship groups, who I know they are who that group as well, but I thought we'd reached out to them. But I think that would be one of the lessons learned, is to make sure we're talking to the right people when it comes to recruiting. But recruitment on any kind of study, whether it's a clinical trial or in this case a physical education app, you need to know who to talk to, and I thought we were, but I guess we weren't. So that's not quite true, but because we do know who the cancer patients are in Rapid City, and we did approach a lot of people to potentially participate, but the reality is not everyone feels well enough to do this. But there are some challenges, but that's okay.
Yes, and there's always tomorrow too.
And so hopefully with this app, if we want to move it forward into a larger survivorship project, this will be helpful. Okay,
great. Just one more question before we finish up. Do you want to discuss any of your key findings?
So, some of for this particular pilot study, I guess some of the key findings were, patients were willing to participate. They did give us feedback about what we should do next time, maybe a little less intensive physical activity. But I kind of look at this in the broader picture of what we're trying to do with Walking Forward, and that is trying to diagnose cancers earlier, to better treatments, to the other end of the spectrum, either helping patients with survivorship, or unfortunately a lot of patients who aren't cured, helping them with their end-of-life care needs. So I think this has the potential to fit into that spectrum of what we're trying to address with Walking Forward.
Great. Well, thank you for your time, and again, very fortunate to have you on the work that you do, and we look forward to seeing you in the future. We will see you on the next edition of Inside CRCAIH. Have a great day.